First of all, I do believe school psychology is an incredible career, but like many careers, there are challenges. You know, the literature in school psychology says the challenges are an excessive caseload, which means not enough school psychologists to the number of students that are involved in our schools. Also, there's concern about lack of administrative support, which would relate to superintendents, deputy superintendents, and principals. And do they really see the value of school psychology? Additionally, there can sometimes be resistance from teachers or teaching teams. So we have ideas about ways we want to make a child's life better, ideas about even research-based interventions, and we'll sometimes hear, well, I'm sorry, there's just not time. That wouldn't be fair. I couldn't implement that program for just one student. I'd have to do it for everyone. Then, to be honest, there's not a lot of advancement for school psychologists. Typically, there's one person in a large district who's the coordinator or the director, but there might be several hundred school psychologists, and there's only one position to advance to that might be administrative. I think there are a number of important things that we can do to sort of at least overcome or reduce some of those barriers. And I do know here, one of the things in particular Dr. Cash does is he has a number of our students. They're very active in Tallahassee and advocating for more mental health professionals and school psychologists in schools. And school funding dramatically affects that ratio. You know, the National Association of School Psychologists really recommends a ratio of about 1 to 750. Unfortunately, Florida, our state, it's more like 1 to 2,500. So there are some financial constraints, and if we could somehow reduce that ratio, that would enable us to have much more impact on students. And I think another stressor that school psychologists talk about is not necessarily being able to see that students are benefiting. And if you only see a student a couple of times, if you only provide an assessment, then you have to move on to the next case. It's a little difficult to see how you've really impacted that particular student. You know, I think one of the biggest challenges for us is the fact that school psychology is extremely complex and diverse. In fact, it's very difficult to know something about all the different facets, and whether it be psychopharmacology, whether it be traumatic brain injury, early childhood, learning disabilities, ADHD. So one of the things that I think really helps school psychologists feel satisfied and happy in their jobs, first of all, they need to recognize the important mission we have. And we cannot let negativity override the important mission we have in just helping children's lives be better. It's also really important that we view ourselves as needing to be an asset to the school district. And related to this, school psychologists need to be able to toot their own horns. I know the 26 years that I worked as a school psychologist, I never left a building without attempting to see the principal and just bring them up to date, he or she, on the work that I'm doing, because we need that administrative support. And I had the chance to really talk on some of this issue at the Florida State Conference recently, and I truly believe the people in school psychology are some of the greatest people I've ever met in my life. And what we need to do is have access to our colleagues, to work on shared projects with them, to be able to seek out collaboration and supervision when we have a difficult case. And I think school psychologists are really the happiest when they have access to their colleagues, when they feel like they're a part of a mission to really provide excellent school psychological services in schools. And that really relates to their self-care, and that we very much hope that they have access to the other school psychologists. They feel a part of a team and a shared mission. And then we obviously hope they're taking care of themselves through exercise and positive self-talk, and really surrounding themselves with people that are positive, people that are encouraging. And I think those are the most important things for self-care.